and welcome to this Trial Site News podcast. I'm Dr. Erin, your host. Thanks for joining in. We're excited to have you here, and we will be chatting about an exciting and promising new study showing how a commonly prescribed drug may impact long COVID. We'll be chatting with Dr. David Goff, who's here joining us. And Dr. Goff, thank you so much for joining in. I'm really excited to talk to you about this study. And do you mind, before we talk about the study, to tell our listeners more about you and what you do?
Well, thank you, Dr. Erin. First of all, let me say how pleased I am to be here with you and your viewers today. And yes, I'm David Goff, and I lead the Division of Cardiovascular Sciences at the National Heart, Lung, and Blood Institute, part of the NIH. And that means I really kind of lead the heart part of heart, lung, and blood. And my background, I trained as a physician and epidemiologist and clinical trialist. And I spent a couple of decades in academics doing patient care, research, teaching, before I came to NIH about 8 years ago. At NIH, one of the things I also do is I serve as a senior scientific program director for the Recover Initiative, which is NIH's long COVID initiative. And while I'm really happy to be here, I also need to make clear that, what we're going to talk about today, I'm going to express my own views and opinions, and it won't necessarily represent the views or the official position of the Institute or the Department of Health and Human Services or the federal government. I have to give that disclaimer when I speak in public like this.
Absolutely understood. And for our listeners, we are going to be talking about the study that was published in the journal Diabetes Care in September of 2024. The title of that article is Prevalent Metformin Use in Adults with Diabetes and the Incidence of Long COVID. And this was an EHR-based cohort study from the Recover program, as you mentioned. And we'll get into that. But first, Dr. Goff, many of our listeners know that metformin is a commonly prescribed drug for those with type 2 diabetes. Can you tell us what was known about metformin, COVID, and long COVID before you conducted this study we're about to talk about?
Sure, thanks. Well, metformin is a really interesting medication. It's been around a long time. We use it commonly in people with type 2 diabetes. So we know a lot about this drug and about its safety profile. It's a safe medication. More recently, there's been interest in metformin because it's been found to have some antiviral properties. And for example, it's been shown to have some activity against Zika and against hepatitis C, which are two other viruses. And more recently, it's been shown to have some potential effects against SARS-CoV-2, which is the virus that causes acute COVID and, for far too many people, long COVID. So before this study was done, a clinical trial had been done that randomized people without diabetes, mostly without diabetes, and maybe 1% of the people had diabetes, mostly without, to either get metformin or a placebo during an acute episode of COVID. And the initial interest was seeing whether acutely use of metformin, because of some of these antiviral properties, whether it would have a benefit in acute COVID. And what they found in that study was that while the primary outcome was borderline, one of the secondary outcomes showed about a 40% reduction in severe COVID outcomes. Severe meaning people went on to either die or have to be in the hospital or get care in an emergency room. They had about a 40% reduction in that outcome, which is pretty impressive. Then they followed those same participants long-term and showed about a 40% reduction in development of long COVID over the next year or so. So this is 2 weeks of metformin showing about a 40% reduction in severe COVID and about a 40% reduction in long COVID over the following year. So that's very promising. Now, the same investigators did what we call a mechanistic study. They looked to see if they could understand why this worked, and they showed that there was a lower measure of what's called viral load. That's the amount of virus that you can detect in the nose in people with COVID. And they showed that metformin reduced that viral load pretty significantly in the acute phase, so within that first week or two. So this was pretty impressive, and so that motivated this next study looking at people with diabetes, because the first study was in people without diabetes.
All right. And so what was your main research question for this study?
Yeah, so in this study, because we had access to these electronic health records, it was a good opportunity to look and see whether current use of metformin in people with diabetes was also associated with a reduction in long COVID outcomes.
All right. And so this was a retrospective cohort study. And for our listeners, that's where researchers look back at data from the past to see how an exposure or something affected a disease or a health condition. Can you describe a brief summary on how you conducted the study overall?
Yeah, so I need to say the scientists in the project did the study, so my job is to provide kind of oversight to the program, to be kind of a steward of the taxpayers' funds that supported it. So while I was not one of the scientists that actually did the study, I can describe what they did. And we funded, for the purposes of what we're talking about today, we had funded two groups of scientists who are experts in doing research with electronic medical record data. And independently, they pulled data together from a large number of hospitals and healthcare systems. And then it was possible to use those data to look at the impact of COVID on health, both acutely and over the long term. And of course, our focus is on long COVID. So first, what they did was they looked to see who was in their database who had a diagnosis of COVID and also had a diagnosis of diabetes. And then they looked at that group of people and they identified whether they were taking metformin or not. Now, they excluded some people who were on some of the newer diabetes medications that your viewers may know about, the GLP-1 receptor agonists and the SGLT2 inhibitors. Some of these newer medications, still not widely used, but they actually may also have some impact on COVID and COVID outcomes. And so they wanted to look very cleanly at the effect of metformin. So they excluded those folks. And then they followed people forward through the medical record over time. That's this kind of retrospective cohort you described. They followed them forward through time by looking at the medical record to see whether people developed long COVID. And they tried to account for other differences between the people treated with metformin and those who were not. Because if you're not getting metformin, you're probably getting something else. And so that could complicate the comparison of metformin versus no metformin.
Now, for the purpose of your study, how did you define long COVID?
Yeah, so long COVID was defined in these two different databases, two different ways. So the first thing they did was they looked for whether a physician had ever given the diagnosis of long COVID to the patient. And there is a diagnostic code for that now. Of course, when we first started this kind of research, there was no diagnostic code for long COVID because it's a new condition. So they used that code. But because we're concerned that that code may miss many people with long COVID, either because it didn't exist at one point or doctors don't know about it, aren't using it, and some doctors may not have fully bought into the idea that long COVID even exists. These researchers also used algorithms or indexes that they developed to look at the data in the electronic health record about symptoms that the patients were reporting, other new medical conditions that were diagnosed, to predict the likelihood that someone had long COVID. And so they used both the diagnosis in one set of analyses and then this likely long COVID as another outcome that would pick up more people, but might also pick up some people who didn't really have long COVID. So it gives an opportunity to look at, two different ways of looking at the outcome. And if you see the same thing, then you're more confident that the findings are probably real.
All right, so to recap for our listeners, we have the population as adults over the age of 21. They have a diagnosis of type 2 diabetes. I'm curious about vaccination status. Did you know whether or not they received a COVID vaccine, and how many even?
Yeah, so the scientists didn't address that in this paper, and I think it's been one of the challenges with tracking vaccine status through electronic health record data, because people get their vaccinations in a number of different places. That personally, the vaccines I've gotten, and I'm fully up to date, they've either been at a vaccine clinic that was set up by the public health department here in Montgomery County, Maryland, or they were at the drugstore that I go to on a regular basis. So I've actually never had my COVID vaccine done in a place where my primary care provider or a hospital would have it in their electronic health record. So that's really kind of an interesting thing to recognize about the ability to know whether these individuals had been vaccinated or not. It's actually pretty challenging.
Right. No, that's really good to point out for sure for our listeners. All right. So some of the key findings from your study, will you share those with us?
Yeah, so there were some differences between the two different databases that the scientists used, but the main finding, I would say, is that there was a modest reduction in the risk of developing long COVID, on the order of about a 10 or 20% relative reduction in risk over about a 6-month period. Now, to try to put that into other numbers that people might find interesting, if you think about the people who have diabetes and develop COVID, if they were taking metformin, then for about every 250 people who were taking metformin, there might be one fewer death or case of long COVID over the next 6 months. So, that's I would say that's an important reduction, right? If you're that person, that's really important. It's perhaps not as big of a effect as we would want to see. I mean, it means we still have work to do, but it shows some promise and may point us in the direction of even more effective therapies long term. The previous trial that was done in people without diabetes indicated that there might be a 40% reduction in risk of long COVID over about a year. And this study shows about maybe a 10 or 20% reduction over the first 6 months or so. So it's interesting to see that difference. Where the truth is it because one group looked at people without diabetes, another group looked at people with diabetes? Is the truth somewhere in between? And one study got a little lucky and another study got a little unlucky. I think we don't know. Clearly, we need more data to replicate both the first clinical trial I mentioned and the study that we're talking about today.
So it's funny, I hear a lot of good things about metformin, not related to long COVID, not isolated to that, or, type 2 diabetes, but just in general, for example, cancer. And there's a lot of excitement about this drug. But regarding long COVID, and I know you touched on this a bit at the beginning of the podcast, but what are the theories, or are there any theories as to why metformin may reduce the risk of long COVID? And I'm going to add on to that, since you just talked about the different patient populations. Is there any, whether you may have type 2 diabetes or not, does that maybe make a difference? Is there any theories there?
Yeah, great questions. Well, some of the things that we've learned about metformin is that it reduces protein translation inside cells. And protein translation is really important for viral replication or viral growth. So viruses, when they invade our cells, they kind of take over the machinery inside our cells to make that machinery create more virus. Okay, that's what the virus does. And eventually the virus, there's so many virus particles inside the cell that it can cause the cell to die and release all those viruses out into the bloodstream or out into the body. And so metformin inhibits protein translation, which inhibits that process of viral replication and inside the cells. And so that's one way in which metformin might work, both to help acute COVID, but also to help long COVID, if the amount of virus in the body is important in driving the risk of long COVID through, mechanisms related to inflammation, immune activation, autoantibodies, and auto reaction to those antibodies. So that's one way. Metformin has also been shown to have some direct anti-inflammatory effects, to tamp down some of the inflammatory mediators that our cells create when we have an inflammatory stimulus like an infection. And chronic inflammation can cause major problems. People probably know about arthritis and conditions like lupus, and these are conditions in which there's chronic inflammation, psoriasis, eczema, there's a number of them. And so metformin, by tamping down inflammation, might also have a benefit on long COVID through that. Of course, there's a lot we still need to learn about why people develop long COVID. And as we learn more about some of the basic pathobiology of long COVID, we may also get other insights into how drugs like metformin work.
So, this is a generic and it's a repurposed drug, so it has the potential to be very cost effective. What are your thoughts on the next best steps to seeing if you can truly use this as a treatment and reliably tell people, yes, this will help?
Well, you're right. Metformin's been around a long time. It's generic. It's pretty cheap. We know it's safe. So it's promising to think about using it more widely. I think right now what would be helpful is to replicate some of the findings of that first trial that showed a pretty big effect, and to replicate some of these findings in people with diabetes, and try to understand why those effects are different, if they really are, or whether this is just kind of a matter of one study getting a little bit stronger signal than another, and the truth being somewhere in between. I suspect that there will be other studies of metformin looking at whether it's helpful when given for long COVID. We don't have those studies yet. At least we don't have results from those studies yet, because right now what we're talking about is two different studies in which we're looking at the use of metformin at the time of the initial infection and whether that affects risk of long COVID long term. But that leads me to think, we probably need studies that see whether metformin, when given to people with long COVID, has a beneficial effect on their symptoms. Now, there's a study going on already in Brazil that's recruiting adults with long COVID and fatigue to see whether metformin use improves fatigue. And there's another small study starting in Pakistan that hasn't really gotten off the ground yet, that is registered in the trial database, and plans to recruit adolescents with long COVID and fatigue. That study hadn't started. The one in Brazil is already recruiting. And, if I had to guess, although my crystal ball is a little murky, I wouldn't be surprised to see trials in the US looking at whether metformin is beneficial in people who already have long COVID, because that would, if metformin were effective to help, oh wow, that'd be fantastic.
No, absolutely. And I think what a big question you bring up and what maybe matters is the timing, when you start it, that kind of thing, which needs to be figured out. Now, are the trials in Brazil and Pakistan, are those affiliated with NIH at all, or those are just separate things happening?
Yeah, so those are separate things happening. There's a database called clinicaltrials.gov where most clinical trials that are going on get registered. And so I looked into that database a couple of days ago, so I would have up-to-date information to share with your viewers. And those were the only two trials I found on use of metformin for long COVID. And I think, as I said, I wouldn't be surprised if there aren't some others in the near future.
Now, are you doing anything there in the realm of long COVID moving forward in terms of research or anything new coming out besides metformin?
Well, so NIH just had a conference last week, or perhaps the week before, on long COVID to really kind of focus on our new part of the Recover initiative that's being called Recover TLC, with TLC standing for Treating Long COVID. So this is a new part of the Recover initiative that's really going to focus more on clinical trials for long COVID. The Recover initiative already has an ongoing set of clinical trials. There are 5 clinical trial platforms testing something like 13 different interventions, if I recall correctly, trying to identify ways to address some of the symptoms that people with long COVID have. And this new component of Recover TLC is going to build on that and really expand, informed by some of what we're learning about the underlying biology. It's also, we intend it would include a focus on pediatrics, which we haven't had in the trials to this point. We certainly learned that children are also suffering from long COVID, and that the symptoms and problems that kids have are a little different from the problems that adults have. So we probably need different trials and testing different interventions in the children with long COVID than we're doing in the adults. So I expect to see a lot of progress in that area in the coming months, and there'll be new trials getting launched, and I'm sure a lot of excitement about that.
Absolutely. And for our listeners, I'll be sure to share the Recover Initiative website just so you can also take a look and see, read about some of these things that Dr. Goff is chatting about. Dr. Goff, it's been a pleasure. Thank you so much for joining in and hearing about this really interesting work on metformin. Is there anything else you'd like to tell our listeners?
Well, Dr. Aaron, thank you for having me here. I think one thing I would say, and probably your listeners are already clued into this, the best way to prevent long COVID is to prevent COVID. And the best way to prevent COVID is stay up to date on your vaccinations. We still don't know why some people who get COVID go on to develop long COVID. We're working on that every day, trying to figure that out so we can prevent long COVID. But that's really, probably the best thing I can emphasize right now. And if you're interested in participating in some of these studies, please do go to our website, because that will point people in the right direction to get involved.
Absolutely, definitely. And I'm sure we'll have some folks who check it out. And thank you to our listeners and viewers for joining in. And hopefully you subscribe to the podcast, and we'll have other great guests on. And yeah, this was great, Dr. Goff. Thank you so much. It was very
Well, thank you, Dr. Aaron.
informative.
Appreciate it.
Absolutely.
Thanks.